What are the early signs of breast cancer? An overview of what breast cancer is. Breast cancer is the uncontrollable expansion of cancerous cells in the breasts. Although it can also occur in men, it is the most prevalent cancer in women. Although the specific etiology of breast cancer is unknown, some people are more at risk than others. Women with specific gene alterations as well as those with a personal or family history of breast cancer are included. If you had your first period before the age of 12, went through menopause later, or were never pregnant, you also have a higher risk of developing breast cancer. Early detection and treatment of breast cancer provide the highest chance for successful treatment. It's crucial to frequently check your breasts and schedule mammograms. The optimum breast cancer screening schedule for you should be discussed with your doctor. Early detection of breast cancer symptoms is crucial because cancer cells have the potential to metastasis, or migrate to other parts of the body. The more quickly you acquire a diagnosis and begin therapy, the better. Symptoms include breast thickening or lumps. It is simpler to feel than to see the first signs of breast cancer. You can familiarize yourself with your breast's typical appearance and sensation by performing a monthly self-exam. Although there is no proof that self-exams can help you find cancer earlier, they can help you be more aware of any changes in your breast tissue. Establish a pattern of checking your breasts at least once a month. A few days after the start of your menstrual cycle is the ideal time to check your breasts. Choose a specified date to inspect your breasts each month if you have already started menopause. To inspect both sides of your breasts, rub your fingers over them with one hand on your hip and the other over your armpits. It's vital to understand that if you feel a lump or thickness in your breasts, you may also detect lumpiness if your breasts are thicker than other women's. Also causing lumpiness is a benign tumor or cyst. Inform your doctor of anything out of the ordinary you notice, even if it doesn't necessarily warrant concern. Although a milky discharge from the nipples is a common sign of breastfeeding, you shouldn't disregard this symptom if you aren't. Nipple discharge that is out of the ordinary may be a sign of breast cancer. Both a clear discharge and a bloody discharge fall under this category. Schedule a consultation with your doctor if you notice a discharge and you are not breastfeeding. They can perform an examination and determine the cause. Changes in the size and shape of the breast. The time of your menstrual cycle may cause a change in size of your breasts, which is not uncommon. In addition to making your breasts tender, swelling can also make it uncomfortable to wear a bra or lay on your stomach. Perfectly normal and infrequently a sign of breast cancer. You shouldn't ignore some alterations, however your breasts might go through specific changes at various times of the month. Speak with your doctor if only one breast is enlarged, or if you see your breast swelling outside of your menstrual cycle. Both breasts maintain their symmetry when there is appropriate swelling. This means that they won't abruptly grow or swell more than the other. Inverted nipple. Nipple appearance changes can occur gradually and are common. Detecting this is simple. The nipple is drawn inward toward the breast rather than projecting forth. The presence of an inverted nipple alone does not indicate breast cancer. Some women naturally have an inverted appearing flat nipple, whereas other women gradually acquire an inverted nipple. Nevertheless, your doctor should perform a cancer exam and rule it out. Pitting breast skin. There are other visible signs of inflammatory breast cancer besides rashes. Your breasts look also changes as a result of this form of cancer. Due to underlying inflammation, you might see dimpling or pitting, and the skin of your breast may start to resemble an orange peel. Skin rash on the breasts. Even while you might not typically link breast cancer with redness or a skin rash, an early sign of inflammatory breast cancer is a rash. The epidermis and lymphatic veins of the breast are both affected by this aggressive type of breast cancer. IBC typically doesn't result in lumps, unlike other forms of breast cancer. However, it's possible for your breasts to swell, get heated, and turn red. Itching is common, and the rash may resemble clusters of bug bites. Peeling, scaling, or flaking skin on your breasts or the area surrounding your nipples is normal and should not cause you to get frightened right away. This is a sign of breast cancer, yet it can also signify eczema, atopic dermatitis, or other skin conditions. To rule out Paget's disease, a form of breast cancer that affects the nipples, your doctor may order tests after doing an examination. These symptoms could be brought on by it. Every woman should become familiar with the early signs of breast cancer. Cancer can be aggressive and life-threatening, but the survival rate is high with early detection and treatment.